Raj's earnings barely sufficed to put food on the table for his family. And recently, he's been feeling very exhausted. He feels like he can't sleep at night and has been getting into frequent fights with Indu. After the most recent argument, he decided he'd had enough and he left home. On a bench, Raj's eyes fell on our Helpline's poster in Marathi. Relating to the problems mentioned and the assurance of confidentiality, he gave us a call. Of course, he was unsure of what to expect and felt guarded at first. But with the support of a trained counselor, he was able to open up freely about his anxieties, his fears, and his concerns. The trained psychologist listened to him empathetically, helped him realize that his problems were linked to his harsh upbringing in the slums, and together they figured out some small steps he could take to feel better. On the other hand, Babu's birth had taken a toll on Indu's well-being. The burden of caring for him, the embarrassment of relying on an Anganwadi worker for his food, and the pressure of managing household duties left her feeling very overwhelmed. Shanta, the cheerful Anganwadi Tai, noticed Indu showing the warning signs of distress that she had just learnt about in Muktaa's community training session. She expressed her concern to Indu, and Indu ended up confiding in her about the constant stress she was under and the toll it had taken on her health. Shanta Tai used active listening, patience, and a non-judgmental attitude to create a safe space for Indu to pour out her heart. After that, they discussed her diet, the care that she needed to take of herself, and Shanta Tai also encouraged Indu to reach out to Muktaa's free helpline, where women like her could talk about their struggles. Taking a leap of faith, Indu borrowed Shanta Tai's phone to give us a call. This conversation played an important role in helping Raj go back to Indu and talk openly about his struggles, what he expected from her, and the way he had been behaving recently. In these two journeys, we find an urgent reminder of the role that mental health helplines like ours can play in bringing hope to those in distress. Muktaa can serve as a guiding light to crores of Rajas and Indus across the country to reach out and receive free, anonymous, and trained professional support in times of crisis. Finally, through training and awareness sessions, we want to make sure that individuals in need get the support that they deserve within and from the communities that they're a part of. Our truly holistic and inclusive approach also links people in distress to free or subsidized government or non-government resources for support. We do this so a farmer in Yavatmal village, a woman in Bihar, or even a student in Pune feels less alone in their distress.